Okay, good evening, everybody. Thanks again for joining us tonight for this virtual town hall reopening edition. I am Andrew Romanov. I'm the marketing coordinator here at Mount Sinai Queens, and I'm joined by several members of our leadership team, Executive Director Karen Schwab, Chief Operating Officer Judy Trillovas, Chief Medical Officer Cameron Hernandez, and Deputy Chief Nursing Officer Jill Goldstein. We also have this evening, hospital epidemiologist, Dr. Dana Mazo. So to get us started, I am going to toss it over to Karen Schwab, if you're ready. Karen?
I am. Good evening, everybody, and welcome to our 16th town hall since the onset of COVID-19. With so much change over the last couple of months, keeping you informed and up to date has been one of our highest priorities. So tonight, we're going to continue moving the conversation forward about recovery, reopening, and returning to whatever our new normal is going to be. But first, we have a lot going on in our world these days, and I'd like to talk a little bit about what's going on in our environment and the impact on the world as well as on Mount Sinai Queens. We're definitely going through a difficult time in our world and in our country. We've experienced a worldwide pandemic that has cost 100,000 lives in our country alone, more than 17,000 in our city. We certainly know that loss, having felt it keenly here at Mount Sinai Queens. Much of our country has shut down, and a good part of our economy. With unemployment at its highest rate since the Great Depression, millions of people are hurting, and a lot of them right here at home. And as states began reopening, there's good news there for getting people back to work and getting us back to our normal lives. But it's also come with high risks, as we've seen in the rising number of COVID patients in many states. We certainly hope that the slow pace of opening here in New York is going to ward off some of that grim news. And then several weeks back, maybe almost a month now, we and so many people in this country witnessed the killing of George Floyd and the callous disregard for his life by the officer who killed him and those who stood by in complicit silence. 8 minutes and 46 seconds is a long time. You realize just how long it is when you stand silently for almost 9 minutes, as many of us did outside the hospital recently. It's plenty of time to think about the injustices in our country. Captured on video, George Floyd's murder sparked national unrest and protests across this entire country. Race, racism, white privilege are not terms white people are particularly comfortable talking about, much less fully understand. Before the onset of COVID-19, our executive team wanted to better educate ourselves. And so we committed to read the book White Fragility together. We were lucky to have Pam Abner from the Office of Diversity and Inclusion lead us in a discussion that I confess was one of the most wrenching conversations I and many of my colleagues can recall having. It upended so many beliefs and ways of thinking, wrong ways of thinking, that many of us held. We're continuing these conversations with Pam and among ourselves, and we'll work to widen them across the hospital over the coming weeks and months. We hope you'll want to be a part of them. Since I came to Mount Sinai Queens, it's 21 years now, we've taken enormous pride in the diversity of our staff. This hospital is rooted in our community here in Queens. And it only makes sense that one of the most diverse neighborhoods in the world should have a hospital whose staff reflects that diversity. So let's keep supporting each other, practicing our values every day, celebrating our differences, and importantly, listening to each other and educating ourselves. I know we can make Mount Sinai Queens an even better hospital, Mount Sinai Health System a better system, and I commit to you that we will do better. Black lives do matter. Tomorrow, as many of you know, is June 19th, and it marks the celebration of Juneteenth, the day in 1865 when General Granger of the Union Army told the slaves of Galveston, Texas, the last in the United States to hear the news, that they were free. Juneteenth is a celebration of African American liberation. In light of recent events, it's all the more important as a symbol and demand for true racial equity. Yesterday, Dr. Davis and Dean Charney announced that everyone in the Mount Sinai community would pause and celebrate a moment of remembrance during Juneteenth. Here at Mount Sinai Queens, our commemoration will be local for each department and unit. We urge you to talk about what it represents and how you would like to pause at some point during the day or night to reflect on justice and equality. So let's use this opportunity to reflect on our place in creating a more just and equitable world and country and hospital. I'm now going to turn the presentation over to Dr. Dana Mazo. She should be a familiar face and name to you by now. She's helped guide us throughout our COVID experience as our hospital epidemiologist. And she's going to talk a bit about some of the updates that are going on in here in the hospital. And then she's going to turn the microphone back over to me. Dana?
Yep, thank you, Karen. So we like to start the town hall with just a sense of where we are with COVID. So this is where New York City is. So to ground us for Queens of where New York City is. So you've seen these graphs, and over time we have seen these graphs get better. So there've been over 200,000 cases. About 53,000 of those cases have been hospitalized, which is about a quarter, and over 17,000 deaths, which is about 8% of total cases, and about a third of those hospitalized. Remember, in New York City, our cases undercount mild disease because for much of the outbreak and really the entire surge, we were only testing patients who had to be admitted to the hospital. So the more mild cases, which is over 80%, were not tested. So the total number of cases is much larger than this number of 207,000. We did that because we had no choice. We had limited number of testing materials, the swabs themselves, the ability to run tests, and also we wanted people, if they didn't have to come to the hospital, to stay home and to self-isolate, not to travel to the hospital. The result of that, as you see, our curves for cases and hospitalizations are basically about the same. There was a very steep increase at the end of March, a plateau with a very steep increase the last few weeks of March, and a plateau the last week of March and the first week of April, followed by a steep decline. As you see, the numbers are much lower now. And then the deaths peaked about 1 week later. The heat map that you see next to it, this is New York City divided up by zip code, and this is a heat map looking at the case rate. So cases of COVID divided by the population of that zip code. The darker the color, the higher the case rate. So as you can see, the highest case rates were in the area of Queens that is just east of us. You see East Elmhurst, Jackson Heights, Corona, all of those are dark, dark purple. Where we are in Astoria, we're sort of a dark pink, so in the higher rates, but not as high as the neighborhoods just east of us, or those neighborhoods in the Bronx, which you can see are also quite purple. Of course, we had many patients who lived in those neighborhoods east of us who came and were our patients who we cared for in the hospital. To give a greater context of where we are with the cases, Worldwide, there have been over 8 million cases with over 440 deaths. And interestingly, the outbreak and the hotspot areas are changing in the world. The US still has the most cases, but we're followed now by Brazil, Russia, India. For a very long time, since the end of February, all of the next countries with the most cases were in Western Europe, but now it has spread. And then as you go farther down the list of the top 10, you get other countries in Central and South America, such as Peru, Chile, Mexico, and with us in North America, and then Pakistan. So again, the outbreaks, the hotspot nations are changing. Similarly, in the US, we now have over 2 million cases, over 110,000 deaths. But as New York City, we are seeing our rates decline. Unfortunately, other areas in the country are seeing their rates increase, specifically in the South, Florida, Georgia, North Carolina, and the Southwest, Arizona, and Texas. Next slide. So as you see with our numbers, these are the numbers of cases in Queens. And as you see, our numbers really mirror what you saw in New York City. Our case rates have basically matched the trends as for Queens. As for Queens and the greater New York City, as you see, we had the increase going up the last 2 weeks of March, and then the plateau the last week of March and the first week of April, and then we had a decline and really continue to have a decline. Today and yesterday, for the past few days, we've only had 2 COVID patients admitted in the hospital. The pink is, the light blue are the confirmed cases, and the pink are the patients under investigation. Remember, we have all of our patients who are admitted at Mount Sinai Queens get tested, and so those will be patients under investigation until the results come back. And that's why that pink has been pretty stable since we started that testing of all admitted patients, which was in the second week of April. But our actual COVID cases have really declined. Next slide, please. And this is the work that you all and all of our staff have done. We've had over 400 cases discharged. Recently, we had 3 patients recently who definitely struck a lot of our hearts because they came in the beginning of June looking very sick, very much like the patients who we saw during the surge. They required high levels of oxygen very quickly within a day or so of their admission, up to needing oxygen through masks. However, we are now in a very different situation from the surge. All 3 of those patients were able to get some of the experimental medications, and all 3 of those patients left the hospital. Two left on no oxygen, and the other one left on only needing oxygen with exertion. So they were doing so much better. The next slide. And so I know there have been some changes. The policies, we have been adapting them as we learn more information and as the prevalence changes in our community, so that we can better protect our patients and our staff. So as I mentioned, all patients who are admitted to Mount Sinai Queens get tested for active infection. They get tested with a SARS-CoV-2 PCR. And for those who test negative, we then say, is there clinical suspicion? And if the patients both test negative and have low clinical suspicion, we call them the other droplet infection flag. Those patients are still on special droplet precautions, meaning an N95 mask and eye protection, but they do not need contact precautions. They do not need routine use of gown and gloves. Now, they might need gown and gloves if they have another multi-drug resistant bacterial infection, or if staff is going in to clean or do something else where you could become exposed to infectious material, infectious with other things, not COVID, just sort of our general standard precautions of when you need gown and gloves. But they do not need routine gown and gloves for COVID protection. As we mentioned, you do still need the special droplet, which is N95 and eye protection, face shield, the mask, the goggles, safety glasses. Your regular glasses do not count. I would say this is one of the questions that we get asked the most often is, I wear glasses. Do I still need to wear eye protection over it? Yes. You do still need the wraparound eye protection. PUI and COVID patients still require contact and special droplet precautions. Move to the next slide, please. One of the other broadcasts that we put out this week was about proper use of face coverings. Remember, face coverings have served two roles. One, they protect the person who is wearing the mask from inhaling droplets that have COVID, but two, they protect people around the person wearing the mask from you exhaling droplets with COVID. Because remember, with COVID, some people are infected with COVID and are asymptomatic. They don't have any symptoms at all. How frequent that is still sort of up for discussion. There can be 40%, it might be 60%, but it definitely is present, and there is some spread from asymptomatic people. How much or how significant is definitely an area of research, but it is possible. And so because of that, part of the reason of wearing the mask is that, so if you have COVID and don't know that you do, if you're wearing a mask over your nose and your mouth, it means that a smaller amount of the COVID virus will get to other people around you. And that's why it's really important not to wear masks with exhalation valves. As you see in those pictures, some masks have valves, and that allows air to come out directly. And so it makes it easier for air that could have COVID virus in it to get out and possibly infect other people. These masks with the exhalation valves were designed really more for protection from paint fumes and construction and things like that. So in the hospital, you cannot wear these types of masks. And for patients, if they come in wearing the masks, we are offering them surgical masks. Thank you, Karen. I believe it goes over to you again.
That was really helpful. We're going to talk about patient experience, and this was a really interesting finding to me, because one might assume that with COVID, our patient experience would have significantly declined. It was definitely challenging for our staff to be in that environment. It was scary, and there were always enormous stresses beyond, I think, what we've ever experienced. There were no visitors allowed, so family and support systems couldn't be at the bedside, and staff not only had to clinically take care of patients, but they also had to be there to comfort them and to support them and to help communicate with their families. These are some of the comments that we heard during our COVID experience. The nurses and nursing assistants make an excellent team. My best to all of them. The staff worked well as a team and had me out of the ER in less than an hour. I could tell all the staff were working hard to do their best. I'm terrified of coronavirus and anxious that I even went to the hospital. But once I was there, I felt relief at how careful everybody was. So the good news is our scores did go up in the first quarter of this year. Now I know COVID didn't hit us until the middle of March, but we're seeing that trend continue into April based on the surveys we're getting back. And the data is so good that Mount Sinai and Mount Sinai Queens are going to be the only two hospitals in the health system that submit our surveys to CMS for the first quarter of 2020. There is an ability to sit back and get a waiver during the first 6 months of the year, given the coronavirus, but we will be submitting the data, and that's just a great credit to all of you and everything you've done throughout this experience. Next slide, please. I'm not going to read this letter, but I wanted to put it up there, and I think everybody could read it. It's relatively self-explanatory. This was a letter that came to Dr. Fernandez-Ranvier for surgery that was performed as we began our recovery phase. And I think it speaks to the confidence that we were able to give this patient about returning to the hospital, feeling safe and well cared for, not only by the patient's surgeon, but by their nurses and anesthesiology. And again, it just shows how important it is for us to be able to build that trust, the confidence in our patients' ability to return to the hospital and make them feel safe. And clearly we did it in this instance, and I know we're doing it in many others. Next slide, please. It's hard to believe that we kicked off our 20th anniversary a year ago, and as part of that kickoff, we opened the Cerebrovascular Stroke Center. And you can see by the bullets that are listed here that we've treated well over 300 patients over the course of the year in the center for cerebrovascular as well as spine disease. 64 of those patients received thrombectomies. That's the removal of a blood clot in the brain that's preventing the blood from flowing. That we had the quickest door to puncture times, the time in which they inserted the catheter in the brain for stroke treatment in the entire health system. And we know that this center, because of the way it was designed, because of the staff and the expertise that we have there, is going to provide enormous research for the future with the hope and expectation that it will influence the way stroke care is delivered not only in this city, but across the country and potentially across the world. We also performed the first vasovertebrae. I know I butchered that word. Cam's gonna be looking at me. Vasovertebral nerve ablation procedure in the health system. And we'll be doing many more of those and learning from them. And based on the experience here, a decision will be made as to whether or not to extend that to other hospitals within the health system. But the good news is that there are a lot of firsts happening at Mount Sinai Queens. And so as we entered our 20th year, Mount Sinai Queens really has become a magnet hospital within our entire health system. Next slide, please. So services are open. We spoke at the last couple of town halls about how we started reopening services here at Mount Sinai Queens in early May. The Stroke Center was one of the first places to reopen with angiograms and spine procedures. Outpatient imaging has been open since the early part of May. It never really closed, but obviously given COVID, it had relatively low activity. It's now up to about 75% of its pre-COVID activity. Pre-surgical testing is doing its normal surgical testing for procedures that are done at the hospital, but we're also doing COVID testing there. So any patient who has a surgery here or a procedure that requires moderate sedation, such as an endoscopy or an IR procedure, and we're even doing COVID testing on our infusion patients, is required to get testing up to 5 days prior to the procedure. Mount Sinai Doctors is well on its way to recovery. It's now at about 70% of its pre-COVID visits, and it's doing in-person visits, but it's also continuing the telehealth visits, which picked up significantly during the course of COVID, as well as telephone visits for those who are not comfortable either coming to the hospital and don't feel able to manage telehealth. Endoscopy is up and running, as is IR. Our infusion center, which had totally shut down during COVID in order for us to consolidate our resources, and we relocated our patients to Ruttenberg at the Manhattan campus, has made an extraordinary comeback. They were running at about 70 to 80% relatively quickly after soon opening, and this week actually exceeded 100% on Tuesday, I believe. So they've made an extraordinary recovery, and that goes to the comfort of patients and their willingness to return to the hospital as well as to our satellite facilities. So I'm going to be speaking a little bit about the kinds of things we're doing to make patients comfortable coming back. Elective surgery is back in business, and the operating this week was actually coming very close to its pre-COVID levels. Next slide, please. So these are our messages to patients, and we're going to be appearing more and more in social media and in our patients' email boxes, encouraging them not to delay needed care. We know throughout COVID, we've been sending a very different message about please don't come to the hospital unless it's truly a crisis emergency. But unfortunately, during that period of time, that delayed treatment put some patients in harm's way. And so we need them now to be willing to return so we can get them back on to a normal schedule. And we, as part of that, need to make sure that they feel comfortable about returning and have confidence that we can create a safe space for them at Mount Sinai Queens. So there's a terrific safety hub that's been set up on the Mount Sinai internet. There's actually a section of the safety hub that's appropriate for staff. So if you have questions about how to protect yourself, please go to that site. There's an enormous amount of information. There's now a portal for patients, and that site continues to get updated as new policies and procedures come up. Next slide, please. And this is just an example of one of the pieces of information that's being handed to patients who are coming back to the hospital. This one is, I believe, for patients undergoing surgery or a procedure, and it's designed in a way to try to, again, explain to them the process they're going to go through, how we're going to do a temperature check and symptom check when they come to the facility before they go for their procedure, what to expect in terms of visiting. I'm going to talk about that a little bit later on, that they do need to get a COVID test before they can proceed with their procedure, and a whole host of things that go to the kinds of frequently asked questions that we're hearing from patients. Next slide, please. And I should say that that brochure is also available in Spanish. So here are some of the things we're doing to keep our patients safe and actually you safe. Housekeeping has been operating under very high standards of disinfection in all areas, particularly touch surfaces. Even though we're hearing now that that may not be as high a level of transmission as we had at one point assumed. We still all want to be very careful about that. Requiring all of our patients as well as our staff to wear a face covering. So if they don't have one when they come in, we're providing that at the entrance. Trying to respect social distancing where we can. We're screening all patients, as I mentioned, for symptoms as well as temperature on arrival, and testing our staff for COVID-19 if you have symptoms or even are asymptomatic. And we've also put in place fairly strict protocols, as Dana talked about, in terms of how we separate infectious patients from non-infectious patients. However, we have recently created non-COVID floors, so 4 East, as well as all of 3 now are non-COVID floors. Next slide, please. So we were lucky enough about a month ago to be selected along with Mount Sinai Hospital as one of the pilot hospitals across the state to be able to introduce visitors. We know how important that is. We know how much anxiety it creates on the part of both our patients in the hospital as well as the family members who are unable to be at the bedside. And even though you did an amazing job in helping to connect our family members with our patients through FaceTime and other mechanisms, nothing can really substitute for having a family member nearby. So over the last couple of weeks, we've welcomed more than 1,300 visitors at the hospital, doing, as I said, symptom and temperature checks at our entrances. What we're allowed to do is 1 visitor per patient at any time and a maximum of 4 hours a day in the hospital. 1 companion may accompany patients to the hospital who are coming for procedures and can remain in the waiting area or intake area until that patient is ready for discharge. And I have to say it's been incredibly well received both by our staff as well as by the patients. And I think everybody has probably heard that this week the governor has now allowed all hospitals in the state to operate under these protocols. There still is visiting, limited and more extensive visiting if necessary for patients who are end of life in palliative care or for pediatric patients, as well as for patients who need a special assistance, either because they're elderly or disabled. Next slide, please. So I don't think we can repeat this enough. Dr. Mazo talked about the potential for a second wave and what we've seen in other cities that have reopened too quickly. We're all trying to guard against that at New York. We're also trying to keep the incredibly low numbers that we're now seeing at the hospital from increasing. So all of these things that we've talked about repeatedly, washing your hands, wearing the recommended PPE, staying home if you're sick, having your family members and friends stay home if they're sick, practicing social distancing where you can, particularly be conscious of the elevator areas, and of course wearing a mask when you're in public and of course when you're in the hospital. Next slide, please. This is another slide that we probably can't talk enough about, and that goes to your well-being. We've spoken a lot about the fact that there are mental health teams that are available and are rounding. We have Rochelle, our chaplain at the hospital, who is also available, and there is a 24/7 crisis response team, and the number is on this slide. We do have the G card that's available, and the recharge room is something new, and I'm going to give you a sneak peek on the next slide. So if I had you able to talk, I would ask where you thought this was, but this is one of the tents on the Mount Sinai Queens campus that has been transformed into a respite space, and we're hoping to open it next week to all of you. It will be available 24/7. And next Tuesday, if you can believe it, it's our 21st anniversary, and we'll be celebrating with a whole host of activities, including Mr. Softy trucks, gifts, cookies, and a video that will be premiered on that day. So we hope the night staff is going to be participating and sending in video clips, excuse me, to Andrew so that you can be part of that video. Next slide, please. Okay, I'm going to turn it back over to Andrew.
Okay, thank you, Karen. So many of you have sent questions to the email address townhallquestionsqueens@mountsinai.org. I have some of those questions here, and I'll ask them to various members of our team on the line right now. Again, just to remind everyone, along with Karen, we're joined by Chief Operating Officer Judy Trillovus, Chief Medical Officer Cameron Hernandez, Deputy Chief Nursing Officer Jill Goldstein, and Hospital Epidemiologist Dana Mazo. And Dr. Mazo, these first two questions are really up your alley, so we'll start with you. So today is June 18th. It's mid-June. We still haven't seen a second spike, a second wave, a second surge. Are we still anticipating a second wave of COVID-19 this summer?
So this is a great question, and I get asked about the second wave a lot, which is why it keeps getting submitted into our questions, and we keep answering it because this is one of the questions that I get asked a lot. I would say I was first asked this question probably end of April, beginning of May, once the surge, our first wave, started to really go down. And then I predicted that it probably would be sort of late fall, sort of winter times, getting ready. That's sort of when seasonally we often see coronaviruses, schools will be back, etc. But we have to know, I don't have a crystal ball. I can't predict exactly, if we'll see a second wave or when we will see it. And part of that is because it really depends on how well all of us are adhering to the mitigation strategies that Karen showed, in one of her last slides. The mitigation strategies of social distancing, wearing masks in public, practicing hand hygiene, those are the key things that all of us New Yorkers need to do to try to postpone a second wave or perhaps hopefully forestall it altogether. The other thing for us is that our governor and mayor, we are reopening the city slowly. June 8th, we had phase 1 of opening, which was, pretty mild. It was manufacturing, construction, some curbside retail. As you probably have heard, it looks likely that next week, June 22nd, we will be able to join our surrounding areas, Long Island and the Hudson Valley, in phase 2. And phase 2 is when things really start to open more. There will be retail, real estate, general offices can be open, outdoor eating, hair salons, they can open, but only at 50% of their usual capacity. So it's really important that as we open up slowly and responsibly, that people still keep doing the mitigation strategies. Unfortunately, we've seen some states, as Karen mentioned, and as I mentioned earlier, we have seen some states who right now are having growing cases and growing number of patients in the hospital. It's not just cases with more testing, it is people who are sick enough who have to go to the hospital. Some of those states opened up very quickly, and perhaps the people, as we see in pictures, are not practicing the mitigation strategies, and that's why it's really important for all of us in New York, all of us who know how bad it can be, keep following these strategies. We're obviously hoping that there won't be a second wave at all, or if it is, it'll be late enough that we will have effective treatments, and perhaps an effective vaccine will be developed before that time. But in the meantime, here at Mount Sinai Queens, we're doing everything we can to make sure that we're ready in case there is another surge. We are maintaining supplies of ventilators, personal protective equipment, other necessary items, such as testing. It's really important to know that even if there is a second wave, it will not be like the first wave was for multiple reasons. One, we've had some experience, so we know what to expect. We already have the supplies. We know how to surge up with space if we have to do that again. And also, most importantly, is all the testing that we're doing. We won't be caught back-footed as we were with the first wave, where we really didn't know how much COVID was already in the community, so we didn't realize what it was until it exploded. Now we're doing lots of testing. I mentioned how every patient admitted is screened. Karen mentioned how every patient going for surgery is screened, so we will notice when there is an increase in numbers. Another big thing is that although we don't have a silver bullet, we do have more medications now than we did at the first wave, and definitely at the beginning. As I mentioned, those patients who were very sick at the beginning of June, they each received the experimental medications, remdesivir, convalescent plasma. Again, these are not silver bullets, but they can help us. There is evidence that they can help some. There are other things that we know now that we didn't know in March. We know the importance of blood thinners. We know the importance of proning, of patients laying on their stomach. At that point, we thought steroids might hurt. As you might have heard now, there is good data out of the UK that steroids help. Now, we had already started using steroids by the middle of April, so we were already starting to use it because there was some data showing that it helps, but now there is stronger data, so we can use it more confidently. So even if there is a second wave, we are much, much more prepared. But again, all of us play an important role as advocates. You're the healthcare workers in your family. People listen to you. And so make sure about the importance of social distancing, wearing masks, washing your hands, cleaning high-touch surfaces. You all know what it was like in the hospital and what we need to do to not have that happen again.
So Dr. Mazo, just to clarify, Are masks and social distancing, in other words, maintaining that 6 feet between you and others, is that still required for in-person meetings? And what should a person do if their shared office or other workspace doesn't allow for a full 6 feet of distance?
So this is another one of the questions that I get asked frequently. And just spoke about in detail and earlier in the presentation, wearing masks and social distancing are really, really important. However, we do need to do our work. And sometimes for patient care, you can't maintain 6 feet, either when you're actively caring for a patient or, if you're huddling to talk about something. So we can't always maintain the 6 feet. That's why it's really important to wear masks. So you want to social distance as much as possible, but if it's not possible in order to do the work that you need to do, then you need to make sure to wear a mask. As you know, the recommendation is for all staff to wear masks whenever they're within 6 feet of another staff member. And this is why. When we sent the broadcast email on Tuesday, talking about the valve masks, attached was also guidelines from the system that we helped to work on about how to stay safe in the offices, because many people who weren't doing direct care are now coming back to their offices, and some of our direct care people, including me, have offices too. So what to do to stay safe in your offices. And the important things are to practice social distancing, wear a mask, talked about the elevators, try to be, at least arm length apart from an elevator. Try not to crowd break rooms. When you're eating, you clearly can't wear a mask. So as much as possible, try to eat more than 6 feet away from other people. So it's really sort of trying to adapt these important mitigation strategies to the practicalities of our life as we work. Talking about shared offices, when I am doing my work, when I'm at Mount Sinai Hospital, I have a shared office. And so I can relate to how difficult it can be to sit there with a mask all day. But that really is the safest thing. Whenever you're in a shared office, you should wear your mask the whole time to protect you and to protect whoever is your office mate.
Thank you, Dr. Mazo. And I'll remind everybody on the line, for the most up-to-date health system policies and other important and current information about COVID-19, you should visit mountsinai.org/coronavirus. Jill Goldstein, I'm going to direct this next question to you. Should we continue to self-monitor with symptom and temperature checks at home?
Yes, Andrew, it is important to continue to self-monitor at home, taking your temperature and monitoring your symptoms. And of course, if you have COVID-19 symptoms, you should call employee health and stay home from work. We will keep you updated. We will keep you updated in the near future if the Institute implements another centralized process where we will communicate clearly and widely to all of you regarding monitoring employees at work.
Thank you, Jill. Okay, this next question is for you, Judy. Emergency Management sent out a survey asking staff members about our experiences here during the COVID-19 outbreak. What have you learned so far from the responses to that survey, and when can we learn more about it?
Thanks, Andrew. Well, first I want to say thank you to everyone who took the time to fill out the survey. I'm happy to report that we had a great cross-section of staff completed. We also did some focus groups with nursing leaderships and department heads to gather additional information. So as you know, it's so important that we review what worked well and what didn't throughout this crisis. We learned from all of this. And that review, I have to say, would not be complete if we hadn't gotten feedback directly from all of you. So what are we doing with it? Well, we're currently in the process of reviewing and collating all the data points we received from the survey and the focus groups. And once it's completed, we're very excited to be able to share it with you. I will say there is more to come.
Thank you, Judy. Okay, Dr. Hernandez, we've heard what feels like conflicting news about LGBTQ rights in healthcare and in the workplace during this past week. Can you clarify some of that and explain what it means for us here and for our patients?
Yeah, this unfortunately started last Friday when the U.S. Department of Health and Human Services said it was removing discrimination protections for transgender patients in healthcare. Then a few days later, the U.S. Supreme Court ruled that LGBTQ people are protected from job discrimination under federal law. Discrimination in healthcare and in the workplace aren't exactly the same thing, but the U.S. Supreme Court ruling is a huge step in the right direction for LGBTQ rights. That ruling could have all kinds of ramifications that make prejudice rules, like the one that we saw on Friday, harder to enact. Fortunately for us, Mount Sinai has time and time again reiterated its commitment to the LGBTQ community in word and in deed. We've been recognized for years as an advocate for LGBTQ health equality, or equity, excuse me. We offer access to comprehensive transgender health services. We treat members of the LGBTQ community like all other patients with dignity and respect, and that will not change.
Thank you, Dr. Hernandez. That's a great sentiment for us to end on. So we'll close it out here. I want to thank everybody again for joining us on this evening's virtual town hall. It's really great that we can get together and share this information. So I wish each and every one of you a wonderful rest of your evening. We'll talk again soon. Good night, everybody.